Hello, everybody. This is Terry with Premom, here with special guest Dr. Zen, who's a
Hello,
naturopathic
everyone.
doctor. This is a special treat today because she agreed to go live and answer any of your TTC questions that she was just sharing with you. We're going to start by getting to know her a little bit, but then we're going to jump into some questions that you had from last time that we didn't get to cover. And also, if you want to ask questions live, we do want to try to keep this to about a half hour, but we may go just a little bit over, depending on doctors, and we don't want to take too much of your time. We're so grateful to have you today.
Thanks so much for having me. I'm excited to chat.
Absolutely. Let's get to know you a little bit. Can you tell us about who you are and your background?
Perfect. So I'm Dr. Alissia Zenhausern, but my patients call me Dr. Zen for short. I'm a naturopathic doctor in Scottsdale, Arizona, and I'm also the founder of NMD Wellness of Scottsdale. So we really focus on preconception, fertility, and postpartum care. So really women's health, but kind of taking a proactive approach. So I really started focusing on women's health, specifically fertility, when I saw patient after patient who didn't really know what to do after getting off of birth control, who felt kind of lost, who were kind of told, okay, if I'm under 35, just go and try to have a baby. And if it doesn't happen, come back to me. And that wasn't the world that I really wanted to work with. I really wanted to take more of that preventative and proactive approach. I really wanted it to really be focused on fertility instead of infertility. What can we do today? Our diet, our lifestyle, our sleep, our environment. What can we be doing today? Because so many of us go online and we're like, okay, like I want to have a baby. What should I do? And you get a lot of mixed information. So by teaming up with Premom, it's been really fun to kind of connect with so many different people. And then in my office, I'm able to see patients both in person and telemedicine, and it's been so much fun.
Great. I think you kind of answered all my questions right there in one. So we'll go on to their questions. That was great.
Sure.
Well, actually, let me just ask one of these a little bit. Do you have a particular type of patient that you or user that you really enjoy working with, like a specialty area?
So specifically, I see quite a bit of PCOS, so polycystic ovarian syndrome. Typically, I'm seeing them they've been on birth control forever, like we all have been, and they're like really scared about getting off of birth control and what that will look like. So I really help patients kind of get their cycle back on track so they're kind of ready for pregnancy. I still see quite a few patients during even IVF treatment, so helping them support every cycle that they go through. Fertility treatments are extremely expensive. And so if there's things that we can be doing today, it can make such a big difference. So I love doing that as well. I feel like it really empowers patients to really get back into the driver's seat of their own health and really start to get in tune with what their body is doing. So partnering with Premom has been so much fun because it allows me to also get information about a patient's cycle in a really clear way. So I love being able to just ask a patient, hey, can you share the code, for the provider? And then I can see all the information. So we're kind of on the same page. So the more information, the better. I think we live in the world of technology and knowledge, but then it can also be really overwhelming where we're like, okay, where do we even start? So that's where I really help guide patients along this process.
Fantastic. All right, let's jump into some questions.
Yay.
We had a question, how can I stimulate ovulation naturally?
So ovulation is something that we need to have in order to have a baby. So having the LH or luteinizing hormone strips like Premom has really allows us to determine when are you ovulating, are you ovulating? So it's really important also to get to the root cause of why are you not ovulating? This can be kind of a precursor. A lot of patients actually don't know that they have polycystic ovarian syndrome or PCOS until they start to get pregnant, and it's challenging to get pregnant. And one of the kind of classifications or clinical pictures that we see is that they are having cycles that are anovulatory. So they are not ovulating. So definitely if you're noticing, hey, I'm not getting an LH surge like all throughout the month, what can I be doing? It's first really important to know what is that root cause, because the treatment will be a little bit different. If it's because you're testosterone levels are very elevated and that's affecting your ability to ovulate, then we have to address that testosterone. Maybe actually it's stress related. And a lot of patients will say, okay, like my doctor said, I just have to calm down and, like I will get pregnant. Of course, those wordings are like, no woman wants to hear that ever. But the idea behind it is true in a way. So cortisol level, so that is released from your beautiful adrenal glands that sit above your kidneys. They are involved in kind of that stress response. So whether it's an external stressor, internal stressor, even exercise is a form of stress. So having the right form of exercise, not doing too much high intensity workouts if that's new to you, that also can be a stressor and can release that cortisol level. Well, if your body is under constant stress, and 2020 has definitely made us all a little bit stressed, to say the least, this can actually cause your cortisol levels not to be able to keep up. So your body's not able to produce enough cortisol. And so in order to keep up with demands, one of the ways that it does this is it steals from progesterone. If you start to steal from progesterone, this also can be an issue why you may not be ovulating correctly or why your levels will be off. And then when it comes to estrogen, this is another big one. It's a big thing that I see in my office, and it's called estrogen dominance. So really what we're noticing is your testosterone and progesterone levels may look normal or maybe a little bit low, but really your estrogen is through the roof. One of the biggest reasons we're noticing these kind of big shifts in estrogen is from medications. This can also change your estrogen levels, not just birth control, but other things that you're taking. This can kind of affect your hormone picture, but also a big one is what food you're eating, as well as your environment. So a lot of our preconception conversations talk about what can we be doing in our environment to adjust this? So there's a lot of chemicals in the basic beauty products that we use. I think last time I checked, in general, a woman uses about 12 beauty products from, their lotions, their body washes, all of those things, but a lot of them have really high levels of chemicals. And so this can affect, and they can actually act as phytoestrogens or act as estrogen. And this can also throw off your body. So it really depends on what side of the equation are we looking at when it comes to ovulation, but there are ways to naturally stimulate it once we kind of get to the root cause.
Wow, fantastic, thank you. A lot to unpack there. Someone asked about natural progesterone without an RX. Thoughts on that?
Yes. Okay. So progesterone is an important part of that luteal phase of your cycle. So that second half of your cycle, it's really important for that progesterone to be not just there, but really at an optimal level. So typically when we look at blood testing, let's say you have a normal 28-day cycle, just to make it easy. We typically check your progesterone levels on cycle day 21. In preconception or optimal levels, we want it actually to be above 10. So a lot of patients don't know that. So if you have gone to your doctor and they're like, oh, I've done my hormones, it was on cycle day 3. Cycle day 3, so the beginning of your cycle, again, cycle day 1 is the first day of your period. So that would be the third day of your period. You can really look at other hormones, estrogen levels, your FSH, your LH. That's a fabulous time to check those levels. However, your progesterone shouldn't be very high during that phase of your cycle, so your follicular phase. So it's going to look lower. And it's not until we check kind of that second half of your cycle, so again, that luteal phase, that we can see that those numbers naturally, gradually increase. For some patients, that's their biggest issue, is that they actually don't increase to that 10 or above. So that's where sometimes bioidentical progesterone can be helpful. So there's a difference between natural per se progesterone, which is kind of the ones that you get online, versus bioidentical and then synthetic. So I'm going to kind of walk you through all three of them. So when it comes to natural progesterone, oftentimes it comes from wild yams. So if you remember the scene in Sex and the City where Samantha is like covering her face in wild yams because she wanted that progesterone, that's what she was doing. The only problem is that that level of progesterone isn't actually in the active form that your body can absorb that is needed for preconception. So eating more yams, taking a supplement that has wild yams in it isn't usually beneficial and doesn't really change your levels that much. So what I typically recommend is bioidentical progesterone, which yes, does require a prescription from your doctor. This is different from synthetic progesterone. So if you remember in the 1990s, kind of Premrin and Premro, those were kind of the main bioidentical hormones. They had a lot of side effects and were kind of linked to breast cancers and other crazy things. Those are very different from bioidentical progesterones that we use today. So bioidentical progesterone still comes from wild yams, or if we use estrogen, it comes from soy, typically based. So it's typically plant-based, but we actually have to still work in the lab in order to create it in the active form that your body can absorb. So it's still relatively important to kind of get that doctor's prescription. And then there's different forms of taking it. So you can take it orally, there's creams, and then there's vaginal suppositories. Typically, personally, I don't love creams. It's really hard to absorb and know how much you're absorbing, and then you can pass it to your partner and that makes it weird. So you don't typically want to do that. But oral or vaginal suppositories are typically what your doctor will recommend. Progesterone is kind of considered the natural Xanax, and that's because it kind of calms your system. So also if you're noticing a lot of anxiety and then we check your progesterone levels and they're really low, adding a little bit of progesterone can help with that stress component of it as well. So we typically recommend progesterone at night just because it can cause you to be a little bit sleepy. So try not to take your progesterone during the middle of the day. And then it is also pretty relatively normal to experience a little bit of breakthrough bleeding the first couple of days that you start progesterone. So don't feel discouraged if all of a sudden you're like, oh, I got my period again, what's going on? I'm trying to get pregnant. It will last a couple of days. Again, talk to your OBGYN or your primary care about this, and they will kind of regulate and kind of see if there's any changes in dosing that needs to be done. But this can also be really valuable to make such a big difference. And then a lot of patients will ask me, okay, well, I was on progesterone prior to pregnancy. What do I do when I do get pregnant? So your OBGYN will kind of make the call whether they want you to stay on progesterone or not. Typically, we keep you on progesterone during that first trimester. That gives the placenta time to grow and develop. And in order for your progesterone levels to stay stabilized during that second and third trimester, we need that placenta to grow. So we usually typically keep you on that progesterone. Maybe we change the dosing, or if you had oral, now we're going to give you vaginal. It really depends on the provider, but we typically actually keep you during that time. So for my patients, I actually am kind of that helicopter doctor, and I typically actually have their HCG levels, which is your pregnancy hormones, and your progesterone checked every couple of weeks during that first trimester. Because typically when you go to your OBGYN, you kind of will have a blood test to say that you're pregnant, and then your next appointment is not until 7 or 8 weeks, maybe even 9 weeks. And that's a long time for things to change. So we kind of want to evaluate more closely.
Awesome. We had a question about the best days to baby dance for a higher chance of conceiving.
So typically we want to make sure the LH strips that Premom offers are awesome. Any LH strips are helpful. So this is important too, because if you start to notice, if you have PCOS, so polycystic ovarian syndrome, actually luteinizing hormone is going to be a little bit more accurate than estrogen level markings. So depending on what brand you use of ovulation predictor kits, they're either going to be checking estrogen levels or luteinizing hormone. So make sure that if you have PCOS or you are concerned that you may have PCOS, that you're using the LH luteinizing hormone trackers. Those are really important. So Premom has the luteinizing hormone tracking ability, so that makes it easy. So what is luteinizing hormone? Luteinizing hormone is a hormone released from the brain to tell the body and the ovaries to ovulate. So this is important because when you check your levels of your luteinizing hormone, you'll start to notice a trend. So typically we recommend try to take your luteinizing hormone or LH ovulation predictor kits or OPKs every day, about after day, right after your cycle. So anytime when you finish your period, kind of start taking them. You want to take them about the same time every day. I typically recommend taking them first thing in the morning, more so like 10 to 12 actually. So kind of mid-morning, I guess. The reason that is because luteinizing hormone comes from the brain and it takes time to make it to the urine. So some people are noticing, hey, I'm not getting an ovulation predictor kit that's positive. What's going on? Am I ovulating or not? You may just be doing it at the wrong time. So some test kits will say do it first thing in the morning, kind of like 7 or 8 a.m. Typically 10 to noon or 10 to 2 even seems to be a little bit better because it gives the hormone time to make it to the urine to make the test positive. So that's going to be really important when it comes to that. Once you kind of use Premom or any app really, to really evaluate where your levels are at, you'll be able to see. What I love about Premom is it's going to show you your luteinizing hormone and it will show you, okay, low, low, high, peak. And so your biggest days or your best days to kind of have timed intercourse is going to be the day of your peak reading of your LH hormone. But again, LH isn't what's causing, or it isn't like a marker of ovulation. It's just right before. So it's really the best day to do it, the day that you get a positive reading and the 24 hours after. It's also important to remember that sperm can live in the vaginal tract for up to 5 days. So you kind of want to evaluate in that time frame as well, but typically you want to make sure that you are having timed intercourse between that positive, really peak day as well as 24 hours later.
Great. We had a question about bromelain. I'm not familiar if that works, if that helps.
So it depends on what you're using it for. So typically, actually, so one of the biggest things we see with PCOS, for example, is we're seeing insulin resistance, which is a little bit different than having diabetes per se, where you're having these really high levels of sugar or glucose. Here, the issue with the insulin part of it is that your cells should kind of have an exchange with sugar that comes into your blood, and then it gives out insulin. So it's kind of like an exchange molecule. What happens, and we see this a lot in PCOS, and is the reason I always check insulin levels, is that all of a sudden those cells no longer respond to insulin, and it causes your blood levels of sugar to remain high because none of your cells are taking it in. So instead of bromelain, I typically recommend actually berberine, which is similar in name, but it can also help with that insulin resistance. It has been shown in some studies, like some early studies, that it could be just as effective as metformin. Typically, if you have PCOS, kind of the main 3 medications that are pretty much given to everyone is going to be birth control, which when you're trying to get pregnant, that's not helpful. And then also it's going to be metformin, and then also spironolactone, which is helping with kind of that facial hair. So unfortunately, a lot of traditional care is taking every patient who has PCOS, treating them exactly the same, when really patients need to be kind of treated individually, because we are all different. We all present differently. We may not have all the same symptoms. So that's really important as well.
Okay, and we had a couple questions about VBT. Someone asked what the benefits of VBT are, and also someone asked, what do you do when you're tracking VBT and you catch a cold? Do you still track with a fever? Or adjust the reading? So I guess if you're sick.
Yes, great question. So I always like basal body temperature, so that's BBT, cervical mucus, and then also ovulation predictor kit, so LH. So I like to use all 3 because it really provides us a good indicator of all 3 things that are happening. Just like the example of if you have a fever, well, the basal body temperature is now a little bit off. What do I do? So typically we're also using these measures month after month. So we're looking for a trend more so than a specific date. So it's really important to use these key indicators prior to pregnancy. I really like patients to start 3 to 6 months before they want to have a baby, so they have an idea what their normal version is. But again, if you're noticing, you have a fever, you got a cold, like it's not your fault and this happens, that's where using those LH strips can be helpful. Maybe you haven't used them in the past, maybe now it's time to use them. So use that as an indicator as well. So you have kind of different markers. That's also nice in the Premom app. You have the different readers that you can actually add in there. You can use basal body temperature, you can do the ovulation predictor kits, you can even do a progesterone level. So there's, Premom is coming out with a new progesterone, which is really exciting. And so that way you can also check your progesterone levels as well. So you can have all that information and really be able to guide your understanding of your cycle, listening to your body, looking for cervical mucus changes, all of those things, so you have a better understanding, because life happens and you may not take an ovulation predictor kit one day. It's okay. It's not the end of the world. Just having those different indicators will help you kind of have a good range of everything that you need.
Great. And I love how you talk about starting tracking even before your TTC. That makes sense. Like just knowing what you're doing before you are actually actively trying.
Exactly. The other thing when it comes to preconception that's really important too is being on birth control over a long period of time. Yes, there's no studies that really show, okay, it has major effects on your fertility per se afterwards. That being said, it also depends on what type of birth control you were on. Depo-Vera, which is the kind of birth control shot, on the ingredient list, if you look, it can tell you that you can expect to get pregnant anywhere between 12 and 18 months after you stopped your last dose. That's a really long time. So also when it comes to oral birth controls, we know that it causes certain deficiencies in our body, sometimes selenium, folic acid, and folate, which is super important in that first trimester of pregnancy. So that's why I say, if you can kind of get off of birth control, start to realize what your cycle looks like, because for a lot of us, we've been on birth control since we were 16. We don't really know, is our cycle regular? What is it going to look like? So if you give yourself a little bit of buffer time, you'll feel a lot more comfortable going into trying to conceive because you have a better understanding of your body per se. So I think taking that proactive approach really helps. And then also, we often talk about prenatal vitamins and when to take them. Should I just take them when I'm pregnant? You need a lot of those nutrients during that first trimester of pregnancy. Oftentimes you're not going to know the minute you're pregnant. So it's really important to kind of start that process beforehand, whether it's a prenatal, taking care of your diet, all of these things make such an impact. I have seen patients who have just gotten pregnant in the first month, who have gotten so much benefit from spending the time a couple months before, whether it was their progesterone levels were off, we were able to fix things. So then when they were ready, everything was kind of smooth. And they also had a better understanding of what was normal for their body or not. I think we're learning how to really listen to our body, and our body is constantly giving us, alert signals all the time. And I think during the pandemic, we've also realized, hey, we need to kind of listen to our body a little bit. There's things going on that, that we may just kind of chuck through and say, okay, we have to keep moving on. We're busy at work and all of these things, but our body is constantly telling us a lot of information.
Great. We had a question about ovarian insufficiency. They'd like to know how to increase their chances of pregnancy if they have premature ovarian insufficiency.
Good question. So pretty much what this means is now the ovaries are not functioning as well as they should be. So typically I highly recommend making sure that you're evaluating what's called AMH, so anti-Müllerian hormone. So that's looking at our ovarian reserve. We don't really have a great test that tells us this is exactly how many eggs you still have left, but it gives us an idea of where you're at. So if you're starting to notice that failure, is it because there's not enough eggs? Are you starting to notice that LH and FSH is starting to increase? So it's kind of interesting. When we go through menopause, what happens really is that the ovaries no longer function the way that they should be, and they start to kind of teeter down in their function. And the brain, in response to that, starts to send out a lot of signals, pretty much like, hello down there, like, can you work? And so you'll start to notice actually your FSH and LH go up as you get closer to menopause. So one thing that's really important, if you're starting to notice that, or maybe your doctor talked to you about your ovarian insufficiency is an issue or concern, is really making sure you get those AMH levels checked, and then also really focusing on egg quality. So what can you be doing today to help with that egg quality? So there's three main things that I really like to focus on. Diet is a big one. What you do with your diet today can have a profound impact on your health, on your baby's health. And I have seen patients who have had lower than normal AMH levels be able to change and reverse so many things by eliminating processed foods, by really focusing on their diet and really I always say a plant-focused diet, not a plant-based diet. You don't have to never eat meat again, but really focusing on about a pound of vegetables per day can really make an impact. You're also giving your liver these great cruciferous vegetables, things like kale and spinach, that help with detoxification. It also helps with hormone production. So that's something that I highly recommend if you are, really needing to get pregnant and things are, maybe not as optimal as you'd like them to be. Really kind of doubling down on your diet is going to be important. Making sure that you can make your diet as organic as possible. If it's not part of the budget, we totally understand it's reality, but it's really important in this short amount of time. So if out of everything, really focus on what's called the Dirty Dozen. It's a list that's released by the Environmental Working Group. You can just go to ewg.org to get access to it. And you'll be able to see what are the top 12 foods this year. So it's an annual list, so make sure you check it every year because things change. Which foods have the most or the highest levels of pesticides. And these are the foods that you want to avoid and make sure that they're organic, kind of your non-negotiable. So things typically like avocados that you don't actually eat the outside layer, those are typically good. You can have those non-organically. It's going to be okay because even though they're sprayed on the outside, typically you're not going to get it on the inside. But things like raspberries or strawberries that really are going to seep into the actual part that you're eating, those are the ones you're going to make sure are organic. There's also companies like Imperfect Produce that allows you to have access to discounted organic foods that can be delivered to your house. So there's a ton of options. So this is kind of something else I really, really recommend. You also really want to focus on your lifestyle. So again, taking out kind of those high toxic, products, whether it's beauty products, home products, you'd be surprised by all the things we're exposed to on a daily basis. Do you have, do you spray your house with Febreze? Do you put, a candle on every day? Do you put all of these things that you may not notice are causing, quite a big toxin overload. And the problem too is that studies don't really show our overall body burden. They often look at their one product or their one chemical and they say, well, this chemical by itself doesn't do any harm. And we're not too worried because it's at a really low dose. Well, that chemical may be in a lot of different products that you're taking. So you're getting much higher doses than typical. So I think that's also really important as well. And then there's also, that's when supplementation and really working potentially with more of an integrative provider, whether it's a naturopathic doctor, a functional medicine doctor, can be really helpful if you're starting to notice that ovarian insufficiency. So things that we really focus on is how can we help with egg quality. So one of the things that we love working with is called myo-inositol. It comes as a powder and has been shown to be really helpful, even in the case of using IVF. So if you're at that point where your doctor's like, hey, I think these measures would be helpful for you, we want to make sure that the actual treatments work and that they're effective and that you're not doing multiple rounds. So what can we do today? So myo-inositol is a supplement that has been shown to be helpful in actually increasing live birth rates in patients doing IVF. So this is huge. And so there are options. So don't feel discouraged. There are different things that you can be doing.
Okay. We had a question about prolactin and elevated levels. Can you speak to that?
Yeah, so prolactin is a hormone released from the brain. Typically, it's released when we are done having a baby and when we have to stimulate breast milk. But in certain women, they actually have elevated levels of prolactin prior to pregnancy. What happens if, many of us know that if you breastfeed, typically it's kind of like a form of birth control. Why is that? It's those prolactin levels that are elevated that are kind of inhibiting your ability to ovulate and get pregnant. So when you have high levels of prolactin, so if you are struggling to get pregnant, highly recommend getting your prolactin levels checked because more often than not, they can sometimes be elevated and this can be the problem. If they're a little bit elevated, so maybe, the range is like, let's say up to 25 and you're at 27, we typically don't do anything for it right away with medication. We kind of just want to see how are your levels advancing in the next month or 2 months. But if your levels are higher than that, or they're maybe 10 times more than the average level and you're not pregnant and you're not breastfeeding, then typically that's when we have to do further evaluation and kind of determine, is there an issue in the brain that is causing that constant stimulation? So typically imaging will be done and then a medication will be needed to be used in order to kind of inhibit or reduce that prolactin so then you can ovulate and then you can get pregnant. So it is much more common than we think, and it's something also that is really valuable to be evaluated when you are in that preconception time. So it's something that I typically recommend on that cycle day 3 blood work is getting your prolactin levels checked.
Great. All right, now I'm switching over to see if anybody's asked any questions live.
Perfect.
Looks like we do.
Yay.
These are doing great. Thank you.
Mhm.
Let's see. Suggestions for diet and PCOS control
Great
for losing
question.
weight. She also mentions losing weight.
Yeah, so one of the biggest issues when it comes to PCOS is that there's this insulin resistance. So again, really focusing on where your sugar comes from is a big issue. Typically, patients who have PCOS kind of present having a higher BMI, and it's really not their fault. So that can be something that's really important to mention. It's not your fault, but what can we do today to make a difference? It's really important to focus on kind of those good, healthy fats. That's going to be helpful for really helping with that egg quality, that part of it, but really focusing on that plant-focused diet. So a pound of vegetables a day sounds like a lot if you're having it all at dinner time. So that's where really evaluating where your levels are at kind of at lunch and at breakfast can also be really helpful. I would say right now there's a big trend with intermittent fasting, and intermittent fasting can be fabulous for reversing prediabetes and diabetes, which often is a risk factor for PCOS patients. However, if you are actively trying, intermittent fasting can actually mess with your cycle a little bit and cause you to be even more irregular. So if you give yourself that 3 to 6 months before you're, planning to try to conceive, you can do some intermittent fasting there, and that can really help lower your levels and help with metabolism. But if you are inactive trying, do not do intermittent fasting. It's not going to be very beneficial. It may make your cycles go crazy, and then you're like, I'm trying everything and it's not working. So that's going to be something that's important. I also recommend typically really focusing on that plant-focused diet, of course, but really focusing on what are you eating? How is your relationship with food? Because oftentimes we either are eating really fast when we're in a Zoom meeting or at work or all these things, and we're not taking a moment to be present or really listen or be intuitive to our body. The other big problem, especially with PCOS, is there's a dire need for sugar. You have this extreme sugar craving and you're like, I am struggling so hard to stay on a healthy diet because I crave sugar at all times of the day. So really focusing on your plant and also your protein intake is going to be important. The more protein that you have throughout the day, the better and easier it is to stabilize your sugar levels as well, making it easier to handle that kind of sugar craving. The other thing that's really fun and that we use in our office, it's called Genema. It's an herb. It comes in a tincture, so that's kind of like a little droplet. It's usually in an alcohol solution. But if a couple of drops on your tongue actually cause your taste buds to go bland for 3 to 5 minutes. And so let's say you're like, I'm craving that sugar, I'm craving that chocolate. If you put a couple of drops on your tongue beforehand, and then you taste that chocolate, you no longer get that taste. So it kind of sends a message to your brain that, hey, I am not getting the satisfaction that I was expecting. So you eat less of it. So it can be something helpful at the beginning to kind of get you off of sugar, but really focusing also, where is that sugar come from? Because a lot of patients will say, well, I don't drink soda, or I don't do treats or dessert or any of that. Where is my sugar coming from? Don't forget that carbs are another big aspect of where we're getting sugar as well. So being careful with breads, pastas, anything that's a simple carb. Doesn't mean you have to get rid of all carbs, but making sure where you're getting your carbs, what are they doing to your body? So complex carbs, things like sweet potatoes, quinoa, oats, those can be really powerful in helping stabilize your sugar levels and helping you during that process. I hope that answered your question, but know that there's plenty that we can do and work on, and don't feel discouraged, because it can be hard, because you can see someone else who doesn't have PCOS and say, hey, they changed their diet and lost all this weight, and I am in this uphill battle. So just know there's a lot that can be done, but be very patient. It can take a little time.
Okay. I think we touched on this question a little bit already, but this person asks, what helps increase progesterone without medication?
So typically progesterone is going to be something that it's important to do the bioidentical progesterone if you're going to do progesterone. But again, stress management, which I know sounds very simple, can make a huge difference, because if your cortisol levels are through the roof and your body's stealing from that progesterone, that can be a major factor. So really focusing on what can I do with my stress today? And you may say, hey, I don't really feel stress, or this is my normal. Well, focus on what you can do today when it comes to stress management. Are you moving regularly? Are you doing any kind of journaling? The whole process of trying to conceive is so overwhelming. And even if you have your partner, your husband, whoever that is with you, they're not going through the day-to-day that you are. And sometimes it can be really daunting and you can feel like you're all by yourself. So journaling can be something that can help you express during this time what is going on. There's also some great meditation apps. I was totally that person that was like Julia Roberts in Eat, Pray, Love, who looked at the clock like after 1 minute and was like, okay, when is this over? And I've learned over time, finding the right type of meditation for you can be a complete game changer. So sitting in a silent room may not be for you. It wasn't for me. Guided meditation may be a better option. There's now virtual reality forms too. So you can have goggles where you can see and look at something. So there's definitely different kinds of forms of stress management that can be really beneficial for you and really help with that progesterone level. But it really comes down really a lot of times to those cortisol levels.
Great. We have a question about ovulation. Is ovulation 12 to 48 hours after the initial peak test, even if you are peaking for 24 hours, or once it begins going back down?
So good question. So typically I say once you get that positive peak level, you have that day, so that 24 hours and the 24 hours after. Again, sperm can live longer than that time frame, but typically shooting for those 2 days is going to be your best option. If you've been kind of doing your ovulation predictor kit like month after month and it's the same couple of days, then you may want to have timed intercourse maybe the day before, because the sperm might already be there, and that also can help versus doing it in the reverse kind of on the back end. So that's where doing testing and ovulation predictor kits more than 1 month can be helpful, because also you may not ovulate every single month. So it's a good idea to look at like 1, 2, maybe even 3 months. And that's where that 3 to 6 months preconception can be helpful. Again, if you're not at that point, you didn't do anything wrong, but you can always make those adjustments now.
Great. The question about birth control, is that the easiest way to regulate PCOS?
So
It's
great
not,
question.
right?
So great, yes. So here's the thing with birth control. Birth control doesn't regulate your hormones or fix your hormones. It just masks your symptoms. So you feel better, or your cycles are more regular per se, but it's actually just because of the medication. That means that the period that you get during birth control is just a withdrawal from the medication. It's that placebo week. It's not actually your body really creating that period. So your period often looks very different while you're on birth control versus not. So that's where, if you do have PCOS, doing the work during that 3 to 6 months prior to can make a big difference. Because PCOS looks different for very different patients, I usually do a metabolizing test for hormones. So I really look at how you metabolize or break down your hormones, because everyone's a little bit different. So diet, lifestyle, supplementation can be helpful, but let's evaluate, what does your version of PCOS really look like?
We had a follow-up question about what you talked about earlier with progesterone. This person said she was placed on progesterone after a D&C and then was spotting during that time since the D&C, and this progesterone made the spotting worse. Is that what you were talking about with the starter bleeding? She said.
Yes, it can definitely happen. So depending on the doses of progesterone given, so typically progesterone can be given in kind of 2 major ways. So either it's based on your cycle. So if you have relatively regular cycles, or you have PCOS and we're trying to get that cycle back together, we can typically give progesterone in the luteal, so the second half of your cycle, and really help boost that level. Some patients will then, that's not enough for them. So then we give them a smaller dose during the follicular phase and then a higher dose during the luteal phase, kind of telling the body, hey, we're supposed to be low on this side, and then we're supposed to get higher on the other. And then for certain patients who've maybe had a miscarriage recently, their doctor maybe say, okay, let's just put you on progesterone the whole time or throughout your cycle. And you can notice a little bit of breakthrough bleeding, but it should go away in a couple of days. Again, if you experience any symptoms, call your doctor, ask them, is this normal? Am I on the right dose? Typically, if you're kind of noticing that breakthrough bleeding that continues and it can't kind of isn't resolving in those first couple of days, it may be that we need to adjust your dosing. So for example, maybe you have a little bit not enough progesterone or maybe a little bit too much. So finding that happy medium. And then sometimes it means let's change the type of method that we're giving it to you. So maybe orally you're causing that problem to happen, or maybe if we give it vaginally, you do a lot better. So it really depends on the patient. But if you experience that, especially after D&C, it can be normal. But again, always just chat with your doctor. A lot of them have portal systems where you can just send a quick little message. You can send a message to their medical assistant. Don't feel like you're bothering them. You know your body better than anyone. The traditional doctor spends between 8 to 9 minutes with you. That's not a lot of time. You know your body best. So make sure that you're reaching out to your provider and just continue to have that good relationship with your doctor. If you feel like you're getting dismissed by your doctor, maybe it's time to find another doctor.
We do have some more questions, but I know it's already 11:45. Do you have a little more time, or should we wrap up?
I have a little more time, yeah.
A little bit? Okay, yeah. Wonderful. This is great.
Yay.
Let's see, yeah.
You guys have some great questions.
I know, these are fantastic, and you're giving great answers. Thank you so much. Someone asked about, she says she has an irregular period after her second baby, and does that mean she has PCOS?
Doesn't always mean, just because you have an irregular cycle now after having a baby, that can mean so many different things. So I work with a lot of patients postpartum because just like when you were trying to conceive, hormones can go all over the place after you have a baby. So a lot of patients will tell me, I always ask them, when's the last time you had blood work when they're postpartum, even a couple months or, even 2-3 years later. And they're like, I think the last time I had blood work was while I was pregnant. So first things first, if you're noticing an irregular cycle and maybe you're trying to get pregnant with baby number 2 or 3, or maybe you just want a normal cycle again, definitely go to your doctor and get traditional annual blood work. That's going to be really helpful. I typically recommend getting blood work anywhere between 2 to 3 months postpartum. Let's say you're 6 months, a year later, not a problem. Just go to your doctor and get those annual labs. The reason that's important is because that irregular cycle can mean a lot of different things. Maybe again, your prolactin levels are a little bit higher than they should be. Are you breastfeeding? Are you not? Will that affect those levels? That can be really helpful. And then things like your thyroid. This is a big topic when it comes to postpartum care. A lot of times your thyroid during pregnancy is going to have to work on creating hormones for your own body, but also for your baby, especially in that first trimester. What happens typically after having a baby is your body sometimes has a little bit of difficulty figuring out what's its own and what isn't anymore. And so this is sometimes where we see a higher increase or higher likelihood to develop a thyroid condition. So typically it's Hashimoto's disease or Graves' disease. So this is where the autoimmune aspect comes in. So pretty much the immune system starts to think that the thyroid that you have no longer belongs to you and starts to attack it. And that can cause a lot of different variety of symptoms. It can cause hair loss, it can cause irregular cycles, it can cause weight gain, weight loss, anxiety, so many different things that especially I notice this a lot with first-time moms is they'll say, I just had a baby, but is this normal how tired I am? Is my hair supposed to fall out like this? Like maybe I'm just like complaining a little bit too much. If something feels abnormal to you, get the blood work because it can make such a big difference to figure out exactly what's going on. But it is pretty normal or typical per se for your cycles to be a little bit different after having a baby. But we want to evaluate, are there any other reasons that that could be happening?
Okay, and I'm going to jump to another question because you mentioned Hashimoto's and someone asked a question about it.
Perfect.
Yeah. She's wondering if there's anything she can do to help with this naturally. She says she's been trying to conceive for 8 months and her levels are within range. And she's wondering about antibody levels as well, if it's more difficult to conceive.
Yeah, so great question. So if you already have Hashimoto's disease, which is a very common disease, especially in women, we are 5 to 7 times more likely to develop a thyroid condition in our lifetime than men. So We often develop it, whether it's before having a baby. Kind of the three main places that we notice thyroid conditions develop is teenage years, so when there's a big shift in hormones, during pregnancy, big shift again, and then during menopause, another big shift. So there's a lot of aspects to hormone regulation and Hashimoto's for sure. You also want to know that depending on your doctor, so the levels typically for TSH, that's thyroid stimulating hormone. If you have Hashimoto's, you know this test very well, but for anyone who doesn't, that's typically what's checked on an annual blood work. And the range goes from about 0.5, depending on the lab, to about 4.5. And typically, if your doctor sees that you're somewhat in that range, they're like, oh, you're in a good range. For preconception, we actually like the level to be 2.5 or below. So this is important, whether you have thyroid disease or not, that your level of TSH is below that 2.5. The biggest reason is during that first trimester of pregnancy, when your baby doesn't have a thyroid and you have to create more thyroid hormone for you and baby, your level is going to naturally increase. So let's say you're closer to 4.5. Well, the minute you get pregnant, your levels are going to, go right into the abnormal range right away, and then they're going to have to put you on medication to kind of lower that level. Where if we can get you down closer to that 2.5 beforehand, then you have a little bit of wiggle room, and that makes a big difference for patients. So that's, for everyone. If you have Hashimoto's disease, whether you have Hashimoto's or not, I would like to kind of put a little caveat, get your thyroid antibody levels checked. So that's anti-TPO and thyroglobulin. Those are kind of the two main antibodies you want to ask for. The reason this is important is your TSH can look totally normal and your antibodies can be really elevated. So a lot of doctors don't check thyroid antibodies because they're like, oh, it doesn't change the way I do treatment. But for me as a naturopathic doctor, there's a lot we can do with antibodies and what we can do to lower them. So we want to make sure that that's evaluated as well, because if your TSH looks normal, maybe is in that normal range, maybe you're on medication, but those antibodies are like, I had a patient the other day, the normal range for anti-TPO for our lab was up to 32 and they were at 500 and their previous doctor was like, oh, that's fine. Like, obviously the body is telling us that something isn't going right. So this is where, again, diet and lifestyle makes a huge difference. So really focusing on avoiding foods that are kind of irritating to the immune system. So one of the big ones we talk about is gluten. Gluten can make a big impact on our immune system, and specifically with Hashimoto's disease. So if you're having a lot of gluten, this can also be triggering. It doesn't mean that you have to go completely gluten-free forever, but try for a couple of months. Typically it takes about 3 months for the immune system to calm down from gluten. So it can take a little bit of time, but then evaluate your thyroid antibodies in 3 months from now and see, are you making that adjustment as needed? There are certain supplements that can also be helpful as well. But again, talk to your particular doctor, especially because you have Hashimoto's, because it can vary depending on your specific needs.
We have a question about Vitex and any recommendations for this person's partner. She says the volume is low, but the sperm count is normal.
Yes. Okay. So let's talk about Vitex first. So chasteberry. So it's a specific type of herb that's really helpful in regulating the cycle. So again, back to the question about PCOS, Vitex can be really beneficial for patients who have those irregular cycles. Vitex can be given kind of throughout the cycle, or it can be given kind of during your period or menses. Really depends on the person, but Vitex is extremely powerful and really helpful. Again, if anyone is taking any medications, again, always consult with your doctor, because herbs do interact. Just because it's natural doesn't mean that it can't interact with certain medications. So you want to be very cautious about what you're taking and how you're taking. And then the second question about sperm count and all of that, it takes two to tango. So ladies, if you are struggling with fertility, make sure that your husband, your partner, is being evaluated. A semen analysis is something that is very inexpensive. It's less than $100 typically. And it can make such a big difference because we can evaluate what is going on. Because a lot of patients will come in and they have been trying for months on end, and they never got their husband evaluated or their partner evaluated. And oftentimes, remember, it takes two to tango. So typically in fertility, about 1/3 of infertility is caused from female factor, another 1/3 is male factor, and then the last third is really a combination of both. So if you can, during that 3 to 6 months prior to pregnancy, get those tests done beforehand, you're kind of on a good rhythm moving forward. That being said, let's say you got your test results and you're like, wait a second, this is not what I expected. One of the things to really evaluate and make sure you have an open conversation with your partner is there's a couple of medications that can actually be detrimental to sperm count. One of them is testosterone. So a lot of men, whether you know it or not, are actually on testosterone in some form or another. And they may be thinking, well, this is like helping my libido and helping all of these aspects. Isn't this going to be great for getting pregnant? It's actually the reverse. It can actually lower sperm concentration and sperm count. So if your partner is on testosterone and they may not even know or put two together or may have never mentioned it to you, definitely have that conversation. Say, hey, by the way, did you know that testosterone can actually lower your sperm count? If a patient is in need of being on testosterone for other reasons, whether they have hypofunction, so they don't actually produce enough sperm at all, during preconception, there's another medication called Clomid, which we also use it in women, but we use it in men too, can be used for that patient as well. So making sure that they also are getting evaluated and things like that can be helpful. Also, overall health for that partner is also important. So making sure that they have good blood pressure, make sure they got their annual labs. I cannot tell you the amount of men in their 20s and 30s who have never been to the doctor or had their blood work done. So evaluating those things can be also really valuable as well. So that's where I would start when it comes to kind of sperm production would be a huge one. I also have an article on my blog as well about sperm production and all of that. So you guys can totally read that. There's more information as well. If you're really interested or you're like, I did all those things already, definitely check it out as well.
Great. All right, we'll take a few more questions and then we'll wrap up here.
Perfect.
Someone asked, does myo-inositol mess with your period?
It can in certain patients. I have definitely seen that. So typically it doesn't. So especially in my PCOS patients, it seems to be really effective and helpful. But I have had some that have noticed, hey, after the third month of taking it, I noticed that my cycle was a little bit more irregular. So if that happens, sometimes we have to lower their dose just a little bit. But good question.
When taking letrozole, should you start adding supplements like myo?
So it depends. So always talk to your REI or your reproductive endocrinologist or your fertility doctor or your OBGYN that you're seeing. It depends on where you are in your cycle. Always consult with your physician first. This is going to be important because they have the backbone of their entire sequence of how they're stimulating you and what they're stimulating. Typically, we can use it, but again, always ask your provider and come to them saying, hey, I heard about myo-inositol. Even if you just do PubMed and you look up myo-inositol, there's a ton of great articles. That way you kind of have a little bit of standing ground. Sometimes it's not the fault of your traditional doctor who may not be open to all of these things. They may not just have the experience with it. So instead of, worrying about it, they just say no. And sometimes that can be really hard for a patient to hear when you're like, hey, I just want to try everything. So if you come in with a little bit of grace too for them and say, hey, this is what I read, I'm interested in it, instead of saying, oh, you never told me about this, or, they'll be a lot more receptive to you in that aspect as well.
Awesome. And you got a great testimonial. I'm in love with this live right now. So helpful. Thank you so much.
Yeah, I'm so glad. You guys had amazing questions. Like, this is so fun.
Yeah, this is great. Is there a hormone that causes longer follicular phases?
So longer follicular phases are typically a problem with your estrogen and progesterone level. So remember, your progesterone level should be highest during that luteal phase. And then during the follicular phase, your estrogen level should be higher. So if you are experiencing kind of a longer follicular phase, meaning a shorter luteal phase or a luteal defect, it can be two things. One is that you don't have enough progesterone, or you have too high estrogen. So estrogen dominance, which we kind of talked about at the beginning. It's much more common than we think. And this is where evaluating, again, if you can in blood work, cycle day 3 and 21. Again, if your cycle is off from a typical 28-day cycle, the adjustment can be made by your doctor as to when they want that second blood draw, but that can evaluate a lot of information. So using Premom can be such a benefit to allow you to determine is my cycle regular? Is everything going? And then use that information going forward. Your doctor is going to be so excited to say, hey, look, I have all the information I need to make the decisions that are right for my patient. So the more that you provide, the better.
All right, we do have more questions, but we are out of time. We also got another great testimonial about how super helpful this is. They love hearing from an expert. Thank you. So if you did not get your question answered, please save it for another time. I'd love to do this again. I thought this went really well.
This is so
Thank
fun.
you so
Question
much.
and answer are like my favorite, because then a lot of people hear other people's questions and then they start asking their own. So this is so fun.
Yeah, so we can come back and check this another time, next time we have Dr. Zen on, if we do this format again. So thank you for sharing and continuing to share. And I do want to make sure I mention that Dr. Zen is right in your Premom app. She's one of our Premom specialists. So you can find her under More and schedule a consultation. Be sure to check that out. And thank you very much, Dr. Zen, for a great session today.
Absolutely. It was so fun. Thanks again. And I hope to see you guys in the virtual consults. And we love doing this. It's so fun.
Thank you again for your participation, and we'll see you all again soon.
Yay. Bye, everyone.
Take care. Bye.